How many of you have ever attended any Baylor Scott and White facility?
Me?
And how many of you are terrified of needles?
Me.
Yeah?
And
Many of you, right? Okay. So that's a pretty common fear for many patients who attend any hospital, not just Baylor Scott and White. But at Baylor Scott and White, in any of their clinics, hospitals, doctors' offices, they use comforting language to encourage their patients to be brave. Whether it be just a simple flu shot or surgery, any procedure, or just being there sometimes can really scare people. So they make sure to use that sort of comforting language with them. And that's just one example of how they use verbal communication to reach their goals within the healthcare. At Baylor Scott and White, there are over 800 patient care sites, which means they are seeing people that are different within their ethnicities, cultural backgrounds, religious beliefs, and all sorts of things. So they are seeing different people all the time, and they have to know how to interact with those people and have a good conversation with them, knowing that they could receive any sort of different response from them, whether it be because of their beliefs or cultural differences. So they have to know how to talk with people and just be able to have a thorough conversation about their healthcare. And to do this, they will use speech acts. Speech acts are usually in the form of a question, and they allow the patient to be able to respond to whether it be the doctor, nurse, any healthcare professional, and understand what is being asked of them. So, for example, they may say, "What sort of symptoms have you been experiencing in the past week?" This is an assertive question that a doctor may ask their patient, but the patient understands what is being asked of them. They feel comfortable sharing their intimate details about their health, and then they're able to reach a conclusion, hopefully. But speech acts are necessary for the doctor to be able to figure out what's going on and reach a goal with their healthcare with their patient. They also, you may observe, have different dialects. So if a patient were to listen in on a conversation between two doctors, for instance, they probably would have no idea what they're saying, could not understand what's going on because they're using more advanced medical terminology. So the dialect between employees within Baylor Scott and White is going to be way different than between a doctor and a patient, which is really interesting that they can go back and forth within a matter of seconds. And it's also important that they can use a different dialect with their patient, so the patient is able to understand completely what is going on and everybody's on the same page. But it does mean that the doctor or healthcare professional is able to communicate differently with their fellow co-workers and with their patients. And so with all of these points, they are using a direct verbal style, whether it be with their patient or coworker or anyone at all. They're going to be assertive and to the point and always clear about their intentions. And this is so important in order to avoid miscommunication because it's the patient's life at hand. So it's important that they're clear about their intentions with the patient and along with everyone else who is working with them to reach the final goal. Now, I have also gotten the opportunity to shadow and observe several different places within Baylor Scott and White Health. So I've seen clinics, I've seen the hospital, I've gotten to be in the operating room, and I have witnessed how the employees at Baylor Scott and White use all of these sort of verbal communication techniques and how they communicated with me as well. I was there as a student, and so I was trying to learn kind of how it works on the inside, and it was just really cool how they were, not only was I trying to leave a good impression on them being a student, but they wanted to leave a good impression on me. They were welcoming, they were informative, and they made sure that I knew what was going on, and they also used that sort of advanced medical terminology dialect with me as well, kind of going back and forth between the two dialects in order to teach me and help me learn. So overall, the verbal communication style at Baylor Scott & White is one that is assertive, but also informative and welcoming, which leaves a lasting good impression on all of their patients, as well as their students, like myself.
Good job.
Would you guys agree?
I would agree.